Hello, my name's Ian Paddick. I'm a medical physicist with about 15 years experience in radiosurgery using Lexell Gamma knife. In this video, I'd like to show you how easy it is to produce conformal high gradient treatment plans using Lexell Gamma Plan. Once you get used to the system, you can quickly construct multi-isocenter treatments to cover even the most complex of targets. I'm now going to demonstrate how I'd make a conformal treatment plan for a vestibular schwannoma. This patient has a 2.5 centimeter diameter lesion, extending into the internal auditory meatus and indenting the brainstem. The patient has useful hearing, so we're going to try to preserve the hearing by protecting the cochlear. Here's a file that I've already created by entering in the patient demographics, importing and defining the MRI scans. The previous steps take just a couple of minutes to complete. We have T1 and T2 weighted MR images for the task of outlining both the target and the organs at risk. First of all, we're going to outline the target. While Lexell Gamma Plan has less fancy outlining tools than some competing planning systems, its simplicity can be an advantage. By using semi-automatic segmentation to outline this enhancing tumor, I am able to outline the whole target in less than a minute. Any adjacent enhancing structures, like vessels that have been included in the segmentation process, can easily be edited out with just a few mouse clicks. We now need to make this outline a target. As this patient has useful hearing, we want to define the cochlear, which is best demonstrated on the T2 weighted images. This can also be outlined swiftly using the semi-automatic segmentation process. We'll then define this as a risk organ, which will allow us to use a process called dynamic shaping later. We'll now place a target matrix around the target volume to define the area where we want to display the isodoses. Next, we'll set up the inverse planning parameters we want to use. The inverse planning feature in Gamma Plan is unlike any other I've seen or worked with. It can usually produce a very conformal treatment plan in just a couple of minutes. First, I'll set the fill function. I can specify smaller or larger collimator sizes to use, but I want to use medium collimator sizes with this plan. Under Optimize, I'll set an equal balance between coverage and selectivity, which is the default of 0.5. Next, I'll select the importance of dose gradient outside the target, which I'll set at 0.24. Now I'll select the importance of beam on time. In this case, I'll select 0.1, which means I'm not that bothered if the final solution incurs a long treatment time. I'm not going to lock sector settings. As for this plan, I don't mind using composite shots, which is when different beam diameters are used in the same isocenter. This can save a significant amount of beam on time, but sometimes at the cost of dose gradient. We're now ready to fill the target. This produces an initial selection of isocenters, as you can see here, but we have to click on Optimize to arrange these into a decent plan. The software is currently producing thousands of iterations to find the optimal solution for the treatment plan. The score function is already a good value, so I can stop it here. We can see that while the plan has excellent conformity in the main body of the tumour, we're lacking a little coverage in the IAM, the internal auditory meatus. We can simply add an additional isocenter here, and now we have a plan with 97% coverage and a selectivity of 0.95, which is excellent. The beauty of this planning system is that you can interact with the inverse planning feature, manually adjusting the isodoses in one particular area to optimize the plan. Let's set a dose of 12 Gray to the 50% isodose. We can now view absolute isodoses around the target. As I mentioned previously, this patient has useful hearing, so we want to protect the cochlear. Using a dose volume histogram, we can see that 1 cubic millimeter is receiving 5.3 Gray. We would ideally like to reduce this down to less than 4 Gray, so we'll use dynamic shaping for this. Let's show the 4-gray isodose and apply a dynamic shaping factor of 1. This doesn't reduce the dose enough, but a dynamic shaping factor of 2 is just about right. Dynamic shaping blocks groups of beams called sectors that pass through the organ at risk. We can manually adjust a few shots where the dynamic shaping has slightly degraded the conformity of the plan. We get a real-time update of the coverage and selectivity of the plan. These two figures, when multiplied together, are equal to the Paddick conformity index. So we know that we already have a plan with an index of about 0.91, which is very good indeed. We can now recheck the dose to the cochlear, which is now just 3.5 gray. Let's preview the treatment protocol. This shows the treatment dose, the number of shots, and the beam on time of 42.4 minutes. So the total treatment time, including patient setup, will be about 42.4 plus 5 minutes, so around 47 minutes. And that's how easy it can be to create a complex treatment plan.